Try these 5 ways to lower your blood pressure without using medication. Having high blood pressure is one of the biggest causes of strokes and heart attacks, so why wouldn't you want to reduce yours? Around 1 in 3 adults have high blood pressure and millions are unaware that they actually have it. But before we go into the 5 ways, we need to understand what the blood pressure numbers mean. So the top number is the pressure of when your heart beats, and the bottom number is the pressure of when your heart is relaxing. I will put some ranges on the screen now because you need to pay attention to what applies to you, because we change the range depending on your age and where you actually take your blood pressure. And we relax the blood pressure readings the older you get, and we relax them if you come into the clinic or hospital to get your blood pressure reading done, as you should be more relaxed in a home setting as opposed to a clinic setting. So let's go into the first way, which is weight loss. Now, excess weight has been associated with increased heart strain, which then leads to a high blood pressure. And as a rule of thumb, for every kilogram lost, you will reduce your blood pressure by both the top and the bottom number by 1 point. And the ways in which you go about weight loss will be covered later on in this video in the other ways. The second way is to improve the amount of physical activity that you are doing on a daily basis. By doing exercise, it strengthens the heart and improves the health of your blood vessels. Now, one thing to bear in mind is that your blood pressure will increase during exercise, but that is only to meet the demands of your muscles at that 1 point. The more you do it, the more efficient your heart becomes, and then it will reduce your blood pressure in the long run. In terms of what exercise to do, you can do resistance training, which is weight training, or you can do aerobic, which is known as cardio. However, if you are focusing on lowering your blood pressure, the best would be to focus on aerobic activity. A good place to start is to increase your activity over what you are currently doing now, but if you want a physical target, then 150 minutes of aerobic activity per week should be that target, and try and encompass strength training and mobility alongside that. The third way is to improve your diet. Now, people are highly aware of the fact that increasing the amount of salt in your diet normally leads to a higher blood pressure, but it's a bit more complex than what meets the eye. Now, some people are actually more prone to the effects of salt, such as African Americans, those with diabetes, chronic kidney disease, and elderly patients. So if they consume salt, their effects will be disproportionate to those who are not within them categories. The chances are, given the modern day diet anyway, that a lot of people are consuming a bit too much salt, and we should try to reduce that anyway, given the fact that all the foods that are ultra processed have higher amounts of this within it. But one thing to note is we don't want too little salt, because salt is important for a lot of functions within the body, and too little salt can be just as bad as having too much salt for your body. If you are in one of the groups that I've just mentioned, trying to aim for 2 to 2.5 grams of salt per day is a good starting point. But another component of your diet that's come to light more over recent years are refined sugars, and the fact that they are highly prevalent in ultra processed food again leads to the same advice of reducing the amount of ultra processed food. By going to a more organic whole food diet, you will cut out the amount of salt that is in excess along with refined sugars, and you will hopefully normalize a lot of your blood pressure readings. The fourth way is to manage your stress. Now, this is easier said than done, because sometimes you can't feel the physical effects of stress, but by being highly stressed normally leads to a higher amount of cortisol within the blood, which also increases your blood pressure. But stress can also lead to an increase in blood pressure in other ways, and it's normally due to how people cope with stress, whether that be to smoke, drink alcohol, not exercise, go for comfort food. Again, all of them things that we've discussed earlier, all of them would lead to a higher blood pressure. So how do we manage this without medication? Meditation, walking in nature, or breathing exercises are simple things that you can implement from day one. One easy breathing exercise is as follows. Take one deep inhalation through your nose. When you feel as though you can't inhale anymore, take a little bit more through your nose and then sigh out the exhale. For example, that seemed a bit weird doing it there, but the last thing I would recommend is also to improve physical activity. That will manage the stress, but then, like I've said earlier, that will also increase the efficiency of the heart and lower blood pressure going forward. And the last way is to improve your sleep. Now, less than 5 hours of sleep per night has been associated with higher blood pressure readings. And that can be due to many things. It can be due to an increase in cortisol, like we've just said before, but also if you're tired, you're not likely to exercise, you're more likely to make bad decisions with regards to food and other activities that would have otherwise improved your health, so you go for the easy option, which necessarily in this world isn't the most healthy. But the best tips to go to sleep are to improve your sleep hygiene. So that is 60 minutes before you would like to go to sleep. Try and set the environment to make it a lot more calming and soothing for you to go to sleep in an easier way. For example, remove all phones, blue light, and anything that overstimulates your brain closer to you going to sleep. Now, if you follow all of these 5 tips, there is a good chance that you will not need medication to manage your blood pressure, or you will prevent getting high blood pressure in the first place. But as always, if you've got any questions, leave them in the comments below. If there's someone that you think will benefit from this video, then please pass it on to them. And as always, thanks for watching if you've got this far.